my name is Casey Broussard. This is going to be my integrative therapy assignment. The patient I chose, I'll call her Mrs. I. She's a 22-year-old African American female that has major changes going on in her life, which has triggered an onset of severe anxiety. She has no previous history of psychiatric mental illness. She presented with symptoms that meet the criteria for generalized anxiety disorder with a recent onset of panic attacks. This all started for her about 6.5 months ago. She claims to, sorry, about 6.5 months ago, when she had a major shift in her jobs and decided to be proactive about initiating a career in business, so resuming school. She claims she's always had some mild anxiety, but never as severe as what she's experiencing or been experiencing in the last few months. She states she's afraid of failure and has been experiencing negative thoughts about having to move forward with the job and school. And although it's not a university, it's a junior college, she still begins to have preconceived ideas about being able to juggle school and work. The thoughts have been causing her to have her heart to race, palms to sweat, racing thoughts about failure has caused her to have poor concentration and a little bit of insomnia. She reported about a month ago that the symptoms got worse. She started exhibiting chest pain and shortness of breath. In conjunction with the symptoms previously mentioned, she decided to seek treatment because she realized that this is just not normal and she can't seem to control her thoughts and actions. She's spoken with a counselor once before as a sophomore because one of her teachers or instructors told her she was arrogant and egocentric and would not succeed in life. So she's kind of been on the downside. It totally flipped her world upside down when that happened. Other than that, she has no history of thoughts of suicide or violence. She did see her primary care physician for physical and EKG to follow up with the recent experience of chest pain and shortness of breath, and everything came back normal, including any additional blood work that was drawn at the time. It was at that point he also suggested that she seek some outside counseling and help for the thoughts that she was having and experiencing. She doesn't drink or smoke. She grew up attending regular church services, but admits she hasn't been there in over a year. She's not really outgoing and doesn't have many friends, kind of homebody. She used to read a lot, but now she just kind of lounges around and watches television, nothing major. Um, Her parents are divorced, and she currently resides with her mom. Her mom, we'll call her Mrs. M, suffered with depression after a divorce of 7 years ago, and she begins to drink at that time, and she continues to live this same lifestyle, and she's unable to maintain a steady job. And the patient, Miss I, reports that she's terrified of becoming that type of person. She has one sibling, a brother that is 2 years older than her, and he left home when he was 17 and has never been back home since. Never been heard from since. So the recommended therapies for a person with this type of disorder is cognitive behavioral therapy, supportive therapy, and insight-orientated therapy. We'll start off with CBT, cognitive behavioral therapy. The goal of this one is to change the patterns of thinking or behavior that is behind this person's difficulties, and so they can change the way they feel. Hopefully, changing her attitude and behavior by focusing on the thoughts, images, and beliefs and attitudes that she's having and trying to get it to shift to a more positive aspect. We'll move from CBT. The next one will be insight orientated psychotherapy, which also works out the assumption that the better you know yourself, the better you will function. Kind of gets into that unconscious portion of the mind and try to change her core assumptions of herself. And then, of course, supportive therapy. Supportive psychotherapy is simply just allowing the patient to express themselves, and she'll give me feedback, hopefully, on how the other two therapies are working in her life outside of our sessions. So, see you with the patient. Okay, so now I'm here with Mrs. I. This is our third session with CBT. So, Mrs. I has, when you first came in, your anxiety level was really elevated. You were at about a 9 on a scale of 1 to 10. How would you say has that improved any at all since the sessions?
I would say it's about a 6. I'm a little better than last time.
And how has what have you been doing outside of the sessions? Have you been working on the goals that we've discussed in the sessions to try to decrease the anxiety in your thoughts?
I've been writing a little. I've been taking your advice. It's been helping.
Is anything changed at home with mom? Is mom seeking any help? Is it improving?
She says she's trying.
How does that make you feel?
I guess it helps a little to know that she's trying for herself and for me.
And does that motivate you to try to move forward as you plan to try to go and get yourself started in school and start initiating that? Does it help with the anxiety in that area? Seeing her trying, does it help you want to try to move forward as well?
I suppose kind of motivates me, but sometimes it's a little bit scary. It's something different.
Okay, so why don't we do this? Why don't we continue to work on the assignments, the homework, the way we discussed previously, and during our next session, I'll let you give me, um, I'll let you produce the documentation to me, and we'll review it and we'll go over it together and see how that's been working for you. Seeing if we're trying to shift these thoughts that you've been having to try to get you to have more positive thoughts. Does that sound? How does that sound to you?
Sounds good. Sounds like something I can try to do.
Okay. Well, we'll discuss it more in the next session. Okay. Okay, we're back with Mrs. I again. This is insight orientated approach to our therapy. This is session number 6. Um, Miss I has been showing some improvement, but hi, Miss I, how are you today?
I'm fine. Thank you.
Miss I, today I want to talk with you about um, how do you. I want you to be able to express to me and tell me, how do you feel about yourself? How do you perceive yourself? Um, you know, what are your thoughts toward yourself as a person outside of the anxiety that you experience when you're trying to make an attempt to move forward? I want you to just give me a little bit of a baseline. Just let me know. Let's talk about where you are, how you're feeling towards yourself at the present time.
Well, usually Mom, she tries to encourage me. She used to, but I really would love to go back to school. I remember I liked art. I liked it a lot.
Does that make you feel good about yourself doing the art? Is that what encouraged you? Is that what motivated you?
Kept me calm, that's for sure.
Oh, that's good.
I think I can do it. I think I can go back. I think I'll do a little art. So
good. We can incorporate the art into the homework assignments perhaps and see if that'll help you to relax. I really would like to know more about your self esteem levels. Are there any changes in that area? You know, are you feeling any different as far as self esteem? Is there anything that's new that's been puzzling you or causing you to have racing thoughts about moving forward and any changes with the causing more anxiety or lessening the anxiety or
I have to say, the only thing that really worries me is starting over, new people, new place. But I can do it. I can do this.
so I see that your thought process is shifting, which is good. This is what we really want. We want you to your thought process to be shifted from the I just can't to yes I can. We want that to shift. So that's really good. Because I'm really pleased with that. So this is what we're gonna work on when we do our next session on the insight um, therapy. I want you to be able to tell me more about how you're feeling about yourself. We want to make sure we support that and get you some encouragement there to be able to move forward. And definitely, I want to know more about this art that's helping you to remain calm and keeping you on a positive thought process. So just we'll discuss this more, and this will be like one of the goals we kind of set for our next meeting. Okay. Okay, we're here again with Mrs. I. This is session number 9. She's been doing really outstanding. This is more of a support therapy. I'm going to give Mrs. I the opportunity to express any concerns or even if she just wants to express any excitement, any changes in that's been going on at home or in her life since we've been having the therapy. So, Mrs. I, this is a chance for you to just be able to express and say whatever it is that you need to say. Has there been any changes that you would like to discuss at this time? You know, as far as the anxiety goes, or home, or anything in particular that you want to talk about right now?
Well, mom got a job, so that's good. It definitely motivates me to take that step forward and actually start school. You know, she even colored with me yesterday. That was something she'd never done. And, in writing down my thoughts definitely helped a lot.
So it sounds like the art and the coloring is kind of motivating you and mom. That's awesome. It's awesome. It's bringing some togetherness there. In the writing, that's good. It's also expressive. So, um, any changes with your self esteem? How we're doing there?
Well, I feel a little better now. I believe the sessions have been very helpful. Just having someone to listen. Mom, she's there a little now, and I feel so alone.
That's good. Anything else you want to talk about today, Mrs. I?
Well, I guess now at this point, I'm ready to actually really take that step forward to starting school.
Are you still having the racing thoughts about starting school?
Well, the thoughts aren't that bad. They come every now and then.
Are you able to control them now? Are you able to stop them and insert some positive thinking there to try to counteract the negative thoughts.
Well, I guess you can say whenever it happens, just kind of coloring begin to relax a little.
Okay. Well, you're doing really well, and I want to continue to see you, and we can talk. And what we're gonna do is, while you're journaling and doing your art, if anything comes up and you need to talk about it in the next session, you just let me know, and we'll go ahead and we'll get it out in the open and see if that will help to relax you and keep this calm atmosphere for you. Okay.